There are many different causes, and I would say your risk factors are included in that. Number one, if you've had a previous history of skin cancer, the risk is almost 100% of developing another one. If you've had a family history of skin cancer, if your skin is very light, if you have blue or green eyes, if your hair is blonde or red, puts you at a higher risk. Lots of moles, the specific type of syndrome called atypical Never syndromes, which are quite common in South Africa, puts people at a higher risk. People who have HIV are at a risk for all cancers. So when your immune system is down, your risk of all cancers are increased, and specifically in skin cancers. Anyone who's had an organ transplant, anyone who's on immunosuppressive treatments, often our patients are organ transplants, they are on immune suppressant treatment, it puts them at a higher risk. So we need to just be careful of those patients. Patients who have inherited problems, like patients with albinism, they are at a very high risk of skin cancer. And then there are other inherited conditions like XP. It's a condition where people are extremely high risk for developing skin cancers, and they generally don't live very long as well. It's important to screen for these cases, but also to put yourself at a low risk. It's also recently shown that for people who spend a lot of time indoors in the week, for instance at work, and have a lot of sun exposure on the weekends, they're at a higher risk for people who generally have a little bit of sun exposure every day. So it's a misconception that if you're indoors the whole week and then you suddenly go out the weekend, that your risk is not that high. And I often get my patients saying that, no, I'm not in the sun at all. But we've got to remember that sitting in a car, there's sun exposure. As we're sitting in an office with the sun coming in behind us, we are exposed to the sun all the time. You can get radiation from the fluorescent globes, from the computer screens, from our cell phone. In fact, that was one of the reasons one of the cell phone companies actually made it that when the phone goes up to your ear, the screen goes off, so that decreases your radiation potential as well. So all of these things have an increased risk. Being overweight, eating unhealthy can affect our risk. It's shown that the more overweight we are, the increased risk of developing any cancer as well, because your immune system is actually suppressed. We're seeing increase in all cancers. Skin and breast cancer specifically have gone up throughout the world. So that's why we're getting self-examination is important. We want people to have their mammograms, do their own examinations, do their mole scans with their dermatologist. Try and look for someone who's got a computerized scanner where you can follow up and look at these things properly. But also get used to examining your own skin. Do it once a month with the whole family, get everyone involved. And simple things like this will pick it up early. If we pick up skin cancer early, it's completely treatable. It's an easy thing to treat if you pick it up early, and that's why we're pushing for these things. If you're at high risk of skin cancer and you've had a melanoma, or you've had a skin cancer every 3 months, we need to do these mole scanning and we need to examine you. If you're at a low risk and you don't have many moles that need to be checked, then we generally say every year, do a scan with your dermatologist, do a mole check, and just make sure everything is fine.